Welcome to After the Bell. I am your host, Lauren Cranmer, and today we are diving deep into tamoxifen versus exemestane. If you are new here, I am Lauren Cranmer. I am a breast cancer while pregnant survivor. I went through stage 3 invasive ductal carcinoma, HER2 negative and hormone positive. So because I was hormone positive, the treatment that I was on included hormonal therapy or endocrine therapy or anti-hormone therapy, whatever you want to call it, to put me in a chemical menopause. And that is so the estrogen in my body is very low, hopefully to prevent recurrence, increase survival rate, and not have my body's cancer cells feed off of the estrogen because there is none. So that's kind of where I'm at. I say all this, I explain this because what I'm talking about today is specifically regarding hormone positive cancers, because part of the treatment is to stop those hormones from producing in your body in order to prevent the cancer from coming back. And that is the whole problem that I'm having currently in regards to the peripheral neuropathy. And my oncologist seems to think that the exemestane that I'm on is the cause of my symptom that I'm having. And he is suggesting that I stop exemestane and I go to tamoxifen. And like when he said that, I was just kind of shocked a little bit because I never thought that tamoxifen was like in the cards for me. And I know that that's a treatment option for hormone positive breast cancer, but just because of my the stage of cancer that I was at, the fact that it was in my lymph nodes and a lot of other factors, I just figured I was going to be on the heavy hitters, forever or for the long haul. And I say heavy hitters because in order to be on an aromatase inhibitor, you have to be put on a Zoladex or a Lupron, shutting down your ovaries, putting you in a menopause in order to do the aromatase inhibitor. If I didn't do Zoladex, which is the one I'm on, I wouldn't be able to do an aromatase inhibitor. It's the mechanism of action of the drug and the way it needs to work, because an aromatase inhibitor, it inhibits aromatase, which is an enzyme that helps convert androgens to estrogens, basically testosterone to estrogen. And when there's no estrogen in your body because of a medication or whatever, your body's smart and they want to help you get estrogen because estrogen is important for other body systems to work appropriately and all of those things. So we want to outsmart our bodies and say, hey, while we don't have estrogen, you also have to stop converting to estrogen because we want these women to feel all the crazy effects of no estrogen in the body. No, that's not the reason. It's for survival. It's for prevention of recurrence, which is amazing and needed. And I'm so thankful that it exists because that's why I'm here. Like these are working for me right now. I'm still no evidence of disease. And I am able to be on this podcast talking to you because of these medicines, these treatments, life-saving treatments to be here. Now, back to the issue. So exemestane is a different kind of aromatase inhibitor. I'm going to get nerdy because I've been researching, ever since I was diagnosed and put on these medications, I've been researching. So it's not like this is all new information to me, but I feel like I have to express this stuff for anybody who's new. Maybe you're just diagnosed, maybe you're on these medications, whatever. I just need to explain everything to kind of get a good picture. And please forgive me. I will be looking at my phone and my notes because there's a lot to cover. And I want to go over exactly the basics. I want to go over my issue, and then I want to go over tamoxifen versus exemestane because that's where I'm at. And I know for sure there's somebody else out there that is also kind of thinking about those two drugs. When I say exemestane, you could also consider other aromatase inhibitors, but exemestane is a little bit of an outlier. It is a little bit different than the other two, which are anastrozole and letrozole. And the reason it's different is because it's not a steroid, but it's steroidal based and it's irreversible. So while anastrozole and letrozole, they are reversible in terms of inhibiting aromatase. Now, exemestane isn't reversible. Now, I'm not a scientist. I do not know what this cause is exactly. I've been trying to look into it and I have yet to find an answer, because in my mind, if it's not reversible, wouldn't that be more beneficial for us instead of having it be reversible? I don't know. I still need answers on that, which hopefully I will get and share with you. Now let's kind of get to the basics of the two drugs. Tamoxifen is a medication that blocks the estrogen receptors in breast cancer cells. Basically, what that is saying is that it's starving the tumor. So the receptors aren't able to get the estrogen. It blocks the estrogen. So there's nothing to feed the cancer. So it is a blocking agent. Now, exemestane, we already talked about this. This is an aromatase inhibitor, and it works by blocking the enzyme aromatase, which is responsible for producing estrogen in postmenopausal women. So that's a much more clear way of saying it than what I just said before. So it's beneficial for postmenopausal women because that is how they get estrogen. Very simply put, it's not always that simple, but you get the idea. So they both target estrogens, but in different ways, and we're going to dive deeper into that, so don't worry. Tamoxifen blocks, exemestane inhibits the production of estrogen. So those are two very different things. Those are the two medications. The side effects, both medications can have side effects. Tamoxifen is associated with an increased risk of blood clots, uterine cancer, and hot flashes. I have so much to say about that. Exemestane is less likely to cause uterine cancer, but it can lead to increased cholesterol levels and bone loss. Now, I can attest to this because my LDLs are high, and I've never experienced that in my life. Bone loss, I have yet to have a severe issue with that, but I do know it's a factor and I try to do my best to take precaution. Now, in regards to the patient population for each of these drugs, tamoxifen can be used in both premenopausal and postmenopausal women, while exemestane is primarily used for postmenopausal women. Now let's talk about clinical trials that have compared these two medications. So several large-scale clinical trials have compared tamoxifen to exemestane, and one notable trial called the TEAM trial showed that exemestane as a first-line therapy may offer a slight survival rate advantage over tamoxifen in postmenopausal women. Switching from tamoxifen to exemestane can be beneficial for some women after a few years of tamoxifen treatment. So the choice between these medications, it ultimately depends on the individual patient and their specific circumstances. Everybody is unique. What factors do the doctors consider when making a treatment decision? There's a lot. We all know this. Some of these factors are menopausal status, age, other health conditions like pre-existing conditions, and personal preference, because we all have a preference of maybe we don't want to have a risk for blood clots, uterine cancer, or stroke, or maybe we don't want to have bone loss, or maybe we don't want either of them, but risk versus benefits, like everybody has their own preference. It's crucial to remember that both tamoxifen and exemestane are powerful medications with side effects, and regular monitoring with your doctor is essential to manage any side effect and ensure the best possible treatment outcome. So again, I'm sure you've heard this over and over again. Talk to your doctor about what you're thinking, what you're researching. Second opinions are always an option too. Always talk. And just a disclaimer, none of this is medical advice. This is me talking about my experience and kind of hashing out with you, deciding on what to do, because my oncologist suggested doing tamoxifen instead of exemestane because of my side effect, which is the neuropathy, which carpal tunnel more specifically, because that's what we decided it is specifically. The neuropathy symptoms I'm experiencing is from carpal tunnel in both hands, and not for nothing, like that just it pisses me off because my oncologist was like, yeah, exemestane is really known for carpal tunnel. I had to do workups. I had to do blood work. I had to get my neck x-rayed. I had to get my hands tested. I had to do all the things. I don't know if he was thinking that and just wanted to cover our bases. I don't know if the communication just wasn't there because it was online. Like I was going in my chart asking him what to do, and he suggested these things to do next. But the carpal tunnel conversation was not had right away. So I don't know. It doesn't really matter because the symptoms are there. And honestly, I've struggled and I'm doing all the things I want to do. Sometimes it's really hard to do fine motor skills. It's frustrating. It's affected my sleep. It's affected a lot of random things I wouldn't have thought of, I guess. And it was enough for me to like talk to my doctor, and see what I could do. And also, I mean, I know like cancer can have some crazy symptoms. So I also wanted to ask about it in regards to recurrence, but thank God none of that was the case. But because of because of how much it's affecting my life, my doctor said, let's try tamoxifen. And like I could do Zoladex and tamoxifen. And even just saying it, right away, my big red flag, I don't want to take a drug that has a huge risk for uterine cancer. I'm taking a drug to avoid cancer. I don't want to take a drug that has a potential to cause uterine cancer. So I just had to look that up because I don't know like the amount of risk or the increased risk you have of uterine cancer when you take tamoxifen. But my quick research is telling me that studies have shown that tamoxifen use increases the risk of endometrial cancer, cancer of the lining of the uterus, by 2 to 7 times compared to women who do not take tamoxifen. Absolute risk, which means like the totality of the risk. It says it's important to remember that the absolute risk of developing uterine cancer while taking tamoxifen is still relatively low. The potential benefits of tamoxifen in reducing the risk of breast cancer recurrence often outweighs the slightly increased risk of uterine cancer. I cannot speak today. Regular monitoring. Close monitoring for any signs of symptoms of uterine cancer is crucial for women taking tamoxifen. I would imagine that would be like a transvaginal ultrasound to check the lining of the uterus. So tamoxifen may slightly increase the risk of stroke. Some studies suggest a small increased risk of stroke, particularly ischemic stroke, which is a stroke caused by blood clot, with tamoxifen use. Magnitude of risk, the exact increase in risk is still being researched and may vary depending on factors like age and other health conditions. So see, now this is conflicting because from my research, what it was saying was that, the stroke is because of it's ischemic. And this says, when I look this way, studies have shown that tamoxifen may increase the risk of blood clots such as DVT, deep vein thrombosis, and pulmonary embolism, which is a PE, by about 2 to 4 times compared to women who do not take tamoxifen. The risk may be higher in the first 2 years of treatment. The absolute risk of developing a blood clot while taking tamoxifen is still relatively low. What is relatively, man? Like, what does that mean? It's important to understand that specific percentages are difficult to give. The risk of bone loss with exemestane can vary significantly from women to women. Factors like age, overall health, and pre-existing bone density play a role. Focus on individual risk. Instead of focusing on a specific percentage, it's more important to discuss with your doctor. So here are my thoughts here, because I'm right now in the phase of figuring out what I want to do, aka pushing off the decision, aka researching sometimes. That's the point that I'm at right now. And the reason I'm having a hard time with this is because of the side effects of tamoxifen. If there wasn't a side effect of blood clots and uterine cancer, I obviously would have said yes. There's still some negative side effects in regards to, like the menopausal symptoms that all these drugs have. They're all similar. It depends on who you are and how it affects you. Everybody's different. But it's hard for me to move past those 2 side effects from tamoxifen. Now, part of me also thinks that if I want to take tamoxifen, I would have to get a hysterectomy so I could completely remove the risk factor of getting uterine cancer. That's like a roadblock in my head, because I feel like that would be the solution, right? To eliminate one of the risky side effects. And I mean, it's excessive. It's also a little logical because that is in the cards for me regardless, because of my diagnosis and all those things. So it's something to think about. Also, surgery is also risky generally, and also just like everything that comes with surgery, like the time out, antibiotics, like that wreck your system, which I don't even want to go there, because I think all the surgeries that I've had, definitely, including with all the antibiotic use I had, just terrorized my gut. But that's a story for another day. Anyway, those things all have to be considered. And then also there is, I immediately, when he told me this, I immediately thought like tamoxifen doesn't have as good outcomes as an ovarian suppressant and an aromatase inhibitor. That's what I had the idea of. Now, while that is true at base level, I don't know how valid it is to base a decision off of. And I say that because, number one, if you look at statistics based on this concept, it's not crazy different, but also the verbiage. And I think sometimes people miss this. So from what I found, I will try to link everything that I have found in the show notes and in the caption. So hopefully you can take a look at it if you want. But from what I found, it says premenopausal women diagnosed with early stage hormone receptor positive breast cancer who took an aromatase inhibitor along with an ovarian suppressant, me, after surgery had a 3.2% lower risk of recurrence than women who took tamoxifen after surgery. Still, there was no difference in overall survival. So, what that says to me is that yes, while people who are taking tamoxifen may have more recurrence rate, 3.2% more recurrence, they still survive the same. I wouldn't want anybody to go through cancer again or anything like that. That's not what I'm saying. But if survival rate is the same, isn't that the overall goal? Is to stay alive. Yes, obviously not to have cancer. But even if we were to have a recurrence, even if we were to have cancer, staying alive is what we want. Right? Like maybe that's breaking it down way too simply, way too basic, but that is a really important thing I think to be considered. Going back to like we are all unique, we are all different. All of these things matter. So for me, looking at me, I had 7 lymph nodes positive. It was stage 3A, hormone positive breast cancer, invasive ductal carcinoma, 7 lymph nodes positive. And if you look at all the little like the data in regards to like your staging with that criteria, like I am very high risk. That makes me want to take every percent, if that makes sense. Like every percent that I can get to reduce the risk. See, I'm going back and forth here because part of me like wants to just like let go and try tamoxifen because I want to not have the struggles that I'm having with my hands. But can I deal with that? Can I figure it out? Can I work with that for the extra couple percent to keep me here and to keep me here for my kids and my family? Because to be quite honest with you, I'm going to be very honest. If I didn't have my family and my kids, especially my kids are my driving factor for literally everything. And that they are the reason I think about these single percents. Do you know what I'm saying? Like if it was just me, I don't know if I would fight for that single percent, but I'm not there. I have my children. I want to be here for as long as I possibly can. And I'm looking at single digits for the odds in my favor. Do you know what I mean? Like that matters. So even just saying that makes me want to stay on this drug, even though I want to not have this symptom. But okay, so I think I've said enough about the 2 drugs. Again, this isn't medical advice. This is just me like hashing it out with you and just thinking it out loud. When we think of, life after diagnosis, life after treatment, I would say more so because that's after everything has truly changed. Not only have you experienced cancer, but you're experiencing side effects. Everything's different, like it's just life is different and we have to kind of just take it for what it is. I posted something the other day. I have a Thriver Tribe group on Facebook that you are welcome to join. It's kind of like an extension of this podcast because I want people who want more out of their lives after cancer, who prioritize wellness, prioritize feeling good together as one unit, helping each other, supporting each other, and just getting positive vibes, empowerment, motivation together. Because a lot of the Facebook groups and all of the cancer communities kind of can like while support is always important and relating is always important, and sometimes complaining and having other people understand is important, I think it's even more important to have people who are on the flip side of that. Like, yes, we have these negative things that we can relate to, but like, let's pump each other up. Like, let's empower each other. Let's live our lives, help each other live our lives to the fullest and to the best and feel our best. And I can go on a tangent, but regardless, everything is different after, and time is precious. And I think it's so loaded, like thinking about time for someone who's dealt with cancer, because when you are diagnosed, correct me if I'm wrong, but one of the first things you think about is like, how long do I got? Like, what's the rest of life look like? That is probably one of the first thoughts you have, if it's not for like your family and loved ones. And it's funny. That's not funny, but it's funny because that was one of my first thoughts. And all I wanted throughout treatment was that for it to work, to have more time for the most important things in my life. And those were my family. I want to have the opportunity to have my health, the opportunity to fight for peace in my life, and just be with my family, be with my loved ones. And that was it. That was really it. And now that I'm almost 4 years out from my diagnosis, in March, it'll be 4. It's funny because there's so much more, time is much more complicated. It's jaded by the time that has elapsed, the time that I wanted so badly. But sometimes it's hard to really want to let down that person who fought so hard. And because the person that I was before cancer is not the person that I was going through treatment, and the person that I am today is not the same person that was going through treatment. While all of those women got me here today, which I'm very thankful for, things change all the freaking time, all the time. And it's just, I think I'm like making zero sense at this point, but I think what I'm getting at, we try to think about the time that we have left, because like the time before we get a recurrence, or the time before while it might not be direct, like there is this concept of time after you're diagnosed. Like before your diagnosis, you're kind of just like willy-nilly. You're not necessarily like thinking about your mortality. You're not. And there's just a different layer after you're diagnosed. And whether you are consciously thinking about it or not, it's there. And I think that's why we weigh these decisions so heavily. You know, a course in a change in treatment isn't just a change in treatment. It's a change in a potential outcome. It's not just a change in side effect. It's a change in potential outcome. It is a change in how good we feel for our lives. Talking to one of my breast cancer friends, and she we totally agreed on this. It's like, we know what this feels like right now. We know what the drugs that we are on are doing to us. We know the side effects. We know like mentally how we feel. Changing that can cause a huge disruption to our lives. And it's not a simple switch. It's not a simple, like, let's see if we feel better. It could be a big thing. And while there's always an option to go back, it's just, going back to time. We just want quality time. We want quality life with the time that we do have. However long it is, it could be very long, but we want it to be quality. Quality is important. And that, I think, is why we weigh these decisions so hard. And I think I say this to myself too, but I think it's okay to question yourself. And I think a good way to combat things like this is, like, instead of like staying in this like deciding bubble, is to give yourself a time limit. And I was talking to this about to my breast cancer friend as well, is that like, if you don't set yourself up with like a time frame of like, this is what I'm going to figure out by this date, you are going to forever keep deciding. And I think it's just important to allow yourself time to figure it out, and understand that it's so valid to take your time. It took me months months to decide to do the Garden Reveal test, which is the ctDNA, it's circulating tumor DNA test. I wasn't sure if I wanted that answer or not. I wasn't sure if I wanted to be told that I had a potential risk of recurrence, like the percentages of how it works. Like the science is new, the information isn't very concrete. So if I were to have a positive result, like then what? Like what would I feel? So it took me months to decide to do that. And I've been doing it for a while now, and I'm glad I have. I've made the decision. I'm very confident in my decision. It's because I took the time to weigh it out, and I don't regret that. My next goal for myself is to try to address inflammation. I say this because like the root of a lot of things like involves inflammation, right? But when we're thinking of carpal tunnel, when we're thinking of like side effects of medications and how they affect your body, like our body isn't happy. Something is not going right. And while we could do everything perfectly and it's still not fix it, I'm still going to try. And I think that will make me feel confident in my decision that I make. So my plan of attack is actually tomorrow I'm starting this little like 5-day reset. It's nutrition based, all clean items. And I'm doing this for just 5 days. And for me, I wanted to do it for kind of like the mental factor as well, to just put myself through this little test to take some bloat away, and to then after that proceed on a nutritional journey to fight inflammation, take things out of my diet, see what makes me feel good, put them back in, etc. And I know this isn't going to be a simple thing. I know it's going to take a while, but I want to try. And if it works, great, amazing. I love that. And if it doesn't, that's okay too. And I'll decide then. But for now, I want to be able to say that I've done what I need to do, or I've tried what I think I need to try in order to make this decision. And for me, that's just one of the things I can consider is I can clean up my diet. I could clean up the things I'm putting in and out of my body. And while I'm doing that already, I could do it more. I'm going to try my best. But with that all being said, I just want you to know that if you have a decision to make, whether it's regarding your treatment or like scans or talking to your doctor, like number one, always advocate for yourself. Always talk to your doctor if you have questions. Questions don't hurt anybody. It's not definitive. You're just talking, right? But if you feel something in your body that's off, talk to your doctor. Like what are they going to say? It's nothing. Or hey, let's do a test or do an exam or whatever it is. That's not going to hurt anybody. But in regards to changes in your treatment plan or stopping treatment plan, you know what's right for you. Number one, you're allowed to think, you're allowed to take your time. You're allowed to do something different from what everybody else thinks. This is you, this is your life. You know what is best for you. Sure, talk to your friends, talk to people that you trust, but you need to feel confident. You don't need anybody else feeling confident for you. You need to feel confident in your decision, and whatever will make you feel that way, you got to do. The more information that I find in regards to tamoxifen or exemestane or aromatase inhibitors, all those things, I'm sure I will be talking about it again. If you have any questions, any comments, please just comment below. Send me an email. Join the Thriver Tribe on Facebook. I'll leave the link. We're in this together, and we're going to figure it out. So with that being said, thank you so much for being here. Thank you so much for listening, and I will see you in the next one.